In this brief introductory segment, we're going to adopt a general perspective on the role of fluorescence visualization with VELscope in dentistry. We'll try to clarify and comment on what might seem to be some very simple questions regarding its use by general practitioners in everyday dentistry. What does the device do? What doesn't it do? In what context should it be used? How shouldn't it be used? This will put us on a solid footing as we move through some of the later segments that discuss in more detail the device's clinical usage. Before we talk specifically about the use of natural tissue fluorescence in the oral cavity, it's instructive to note that its use as an aid to disease detection and management dates back several decades. The lung was one of the first areas investigated, and there has been a lot of research published not only on the lung but also the colon, skin, and particularly the cervix. It's only in the past few years that researchers thought to apply this technique in the oral cavity. Perhaps the first commercial application of fluorescence imaging and visualization arose out of the pioneering work of clinicians and scientists from the British Columbia Cancer Agency in Vancouver, Canada. The OncoLife device, commercialized by a Vancouver-based company, Zilix Technologies, was a fluorescence-based endoscopy system used to help clinicians identify suspicious areas in the lung during a bronchoscopy. The promise of this technique led other major manufacturers such as Storz, Pentax, and Wolf to develop their own lung fluorescence endoscopy systems. When the scientists and clinicians at the BC Cancer Agency turned their attention to using fluorescence in the oral cavity, early promising results led to a partnership with LED Dental to develop and then later commercialize what came to be known as the VELscope system. Let's talk a little bit about how we should view this technique of fluorescence visualization. This slide is based on one that I saw from a presentation at an oral surgery meeting on different imaging modalities used to provide information on pathology in the head and neck region. It struck me at the time that this was a good way to introduce the concept of fluorescence visualization. Just like a lot of these other imaging techniques, panoramic radiography, CT, cone beam CT, MRI, PET, ultrasound, fluorescence visualization is not a standalone diagnostic test. It is another item in the arsenal of tools clinicians have to help them assess the health of human tissues. These techniques are inevitably part of a larger picture that includes a lot of other information from other sources. Also, they are more useful in some contexts than in others. The value they bring often depends on the particular type of clinical situation in which they are used. Like these other methods, fluorescence visualization with VELscope adds value because it provides visual information that cannot be acquired in any other way. The fluorescence response of warm mucosal tissue to violent blue excitation light. We'll see in later segments that this is very sensitive to disease processes occurring within the tissue. Also, unlike some of these other methods, ease of use is a big plus. Tissue can be visualized in real time directly with our eyes. For a permanent record, the fluorescence information can be converted into static images, or even movies without much difficulty. Every new clinical technique or tool requires some investment in time and effort to fully understand and appreciate. One of the primary values of fluorescence visualization with VELscope is as an adjunctive screening device to examine asymptomatic individuals to discover areas of concern that are subtle or otherwise might be overlooked during the visual and tactile exam. After the visible or white light exam, VELscope is initially used to provide a general survey of the oral cavity to enhance the visualization or discovery of abnormal areas. This can be compared to the type of information that a clinician may discover when viewing a panoramic radiograph, which displays information or conditions that were previously undetected during the visual examination. Once an area of concern has been detected, the clinician focuses their attention on the area, looking for details of how it presents. This might be compared to how an additional periapical or bite wing radiograph might be utilized after an area is discovered on a panoramic radiographic image. This additional radiographic view is beneficial to facilitate investigation of disease that is not readily perceived by the human eye. For example, a vertical bite wing for evaluation of bone loss in periodontal disease, or radiolucence of interproximal regions for dental caries. While radiography provides indirect visual images of human tissue that is displayed either on a computer monitor or on radiographic film, VELscope uses direct, real-time visualization of the tissue. Similar to radiographic interpretation and imaging, VELscope utilization requires an understanding of underlying principles, a sound background in anatomy and physiology, and an appreciation of normal variance. This understanding is a key to taking full advantage of the technology and using it to discover abnormalities that truly warrant further investigation. To summarize, VELscope is a survey tool, helps discover abnormalities that might otherwise have been overlooked, is initially unfamiliar territory and thus requires training and experience to fully utilize. It's best used as a survey tool that directs the clinician's attention to specific areas. And it's another means to visualize the disease process that complements rather than replaces the clinical impression. It facilitates rather than provides a diagnosis. And it is most definitely not a standalone diagnostic device.